next? Are you going to be voting to repeal that?
Will I be voting to repeal it? Yeah.
Run to repeal?
Mm-hmm.
Are you also going to be rejecting government-sponsored health care for yourself?
You mean the government pools that we're in, or what?
Yeah, well, the Federal Employee Benefits Program, I know your colleague Congressman Kinzinger has rejected that and said he's not going to take government-sponsored health care. Is that something you think you'll join him in?
You know, it's interesting. Since I came to Congress, my health care actually is more expensive.
Is that right?
It is, yeah. I had Blue Cross Blue Shield when I came here as a 27-year-old single male.
Mm-hmm.
I paid about $80 a month.
Mm-hmm.
And now, because I'm in a risk pool with a bunch of older seniors, my health care costs me, I think it's $170 a month now for the same Blue Cross Blue Shield coverage. So I think it's kind of interesting how people make such a big deal out of the health care coverage we have, which is not bad by any means. But I haven't really given it much thought because, quite frankly, I think I'm helping out the institution by lowering the risk pool for some of my older guys.
I just know that there are a lot of people who have made, the hypocrisy charge that there's an average of $700 per month in taxpayer subsidies on these employee government healthcare plans, yet, saying that the general public's not getting the same types of subsidies and help in buying health insurance for themselves.
Right. No, I get that argument. I mean, the only thing I would submit is because I'm an outlier in the group, I'm actually lowering when you're under 30 in a body of,
yeah.
Well, sir, I mean, you receive the taxpayer subsidies even though you do have a lower rate, and you're within a pool that's highly regulated, as health reform does for the rest of the nation. Don't you think it's fair, if you're going to repeal health reform for everyone else, you should at least reject this subsidized, highly regulated plan that members of Congress and their staff benefit from?
No, I actually think they're completely separate issues.
Why is that?
Because I don't think what we do with the health care bill has anything to do with what kind of health insurance programs members of Congress pay for. I mean,
no, it's quite similar. There's an exchange. There's subsidies, just like you benefit from an exchange and subsidies that are paid for by taxpayers.
I think the bill that was voted on is completely different.